So I'm Barb Conley, and I'm going to introduce this next session. We have three great speakers here. But how do we get a handle on clinical utility with the craft of developmental therapeutics? We don't necessarily want to continue with a randomized clinical trial where, we don't characterize the patients any further than you're here and your organ function is okay. However, we do know that most of the drivers may be seen in very small subsets of patients. And how do we put this information into doing better developmental therapeutics to get these clinical utility data? We don't know in many cases whether these drivers also have prognostic implications. Sometimes we don't even know how well they'll respond to whatever agent is putatively targeted to those agents. So how do we get the evidence that patients will benefit by being treated in a different way than what we have already devised? We do know that current cancer treatment is not really satisfactory for most of us, especially in the metastatic setting. There are two different kinds of trials that have sort of gotten some play. One is the umbrella trial. You have one disease, but you're going to have several cohorts treated in different targeted ways. And then the basket trial, where you have sort of a drug and predictive marker pair, and then you're going to try it in different tumors. So with that, I'm going to introduce our first speaker, who I think is Roy Herbst, and he will be talking to us a little bit about the thought processes behind LungMap, which recently started.